Om Swastiastu. Hi everyone, we are from Sgd B6 and in this occasion we will present our student project entitled Stunting in Children. Here are our members. Background. Early development in children is more critical than later due to at this time, the basic growth will determine and influence the next development. Lack of nutrition in stunted children will affect the child's optimal growth. If stunting increases, the impact related to academic performance and self-productivity will greatly affect the quality of the country's population in the future. Child stunting reduction is the first of 6 goals in the Global Nutrition Targets for 2025. More than 1 in 5 children under age 5 worldwide has stunted growth. With the high percentage of stunting and the impact of stunting, the author hopes that this student project can provide information and further prevent stunting by explaining how to prevent it.
Here I'm going to be discussing the problem identification of the student project. The first question is, what is the definition and signs of stunting? The second question is, what is the pathophysiology and etiology of stunting? The third question is, how is stunting diagnosed? The fourth question is, how can stunting be prevented in the prenatal and postnatal approach? This final question is, how can stunting be treated? Next, for the purpose identification, the first purpose is to know the definition and clear signs of stunting. The second purpose is to understand the pathophysiology and etiology of stunting. The third purpose is to understand how to diagnose stunting. The fourth purpose is to know how to prevent stunting in the prenatal and postnatal approach. And the final purpose is to understand the treatment options for stunting.
So the significances of this paper is that writers expect to provide a more complete understanding of stunting in children, including its definition, prevalence, prevention, and management. The writers would also like to contribute to future research by providing a source of reference and input in form of this paper. Thank you.
Stunting is the impairment of growth and development in children, which can be determined if a child's height for age is higher than 2 standards deviation below the World Health Organization Child Growth Standard Median. The first 1,000 days from conception to around 2 years old are crucial in the developing stunted children, as it is the basis for the optimum health and development throughout the lifespan. There are few signs of stunting. The first one is shorter than the other kids at the same age. Body proportions tend to be normal, but they are appearing younger for their age, lower in weight than other kids at the same age, and also delayed bone growth.
Stunting prevalences. Although worldwide stunting rate decreased year by year, 22% rate at 2020 does not help to reach WHO target of 40% reduction of stunting under 5 in 2025. Next, also in 2020, Asia comes second after Africa in terms of stunting rate at 21.8%, and Southeast Asia regional rate comes at 27.8%. In Indonesia, stunting rate comes at 21.6% in 2022, which decreased 2.8% from the previous year. During that year, Bali ranked the lowest at only 8% rate, meanwhile East Nusa Tenggara occupied the top position. Indonesia still need a constant 3.8% drop to reach Ministry of Health RPJMN's target in 2024.
Pathogenesis and pathophysiology of stunting. The pathogenesis of stunting involves complex interactions between environmental, nutritional, and infectious factors, which ultimately leads to impaired growth and development. First, environmental factors like poor sanitation can contribute to stunting through a complex set of physiological responses, including intestinal infections, impaired gut function, immune activation, and impaired cognitive function, and can also lead to malabsorption of nutrients and dehydration. Additionally, exposure to environmental toxins such as lead and cadmium can also interfere with bone growth and contribute to stunted growth. Second is nutritional factors. Insufficient intake of essential amino acids such as lysine and tryptophan can impair the synthesis of growth-promoting hormones such as insulin-like growth factor 1 and reduce the efficiency of protein synthesis in the body. Also, deficiencies in micronutrients like iron, zinc, and vitamin A can affect physiological processes including bone formation, immune function, and cognitive development. Third is infectious factors. Infections, particularly caused by intestinal parasites and other pathogens, can interfere with nutrient absorption and utilization. The immune system responding to infections can also trigger the release of pro inflammatory cytokines, which can impair growth hormone signaling and reduce the efficiency of protein synthesis.
The phenomenon itself can be determined or diagnosed eventually through anthropometric measurements during a physical examination. It is known that the length or height for age of stunting is 2 standard deviations below the median. An example can be seen from the graph given. For instance, if the plotted data of length or height for age is below the -2 standard deviation line, then it can be confirmed that the child is stunted. In addition, anamnesis can also be performed to identify and evaluate the cause of stunting, coming up with solutions on how to deal with it. Stunting is an effect of prolonged malnutrition due to environmental factors, inadequate nutrition of mother and fetus, and others. These risk factors may happen due to socioeconomic factors, which are highly dependent on the economy, education, political, and national security status of a country. These factors are the ones that may impact to the access of food with sufficient nutrition, proper facilities, and sanitized environment. In present times, cases of stunting are most likely to be found in developing countries with low to middle incomes. The second SDG itself stated zero hunger, which means to wipe out poverty, including the eradication of stunting, as it is an effect of hunger, and thus government needs to pay attention as well.
So let's talk about the stunting prevention. So there's this phenomenon that happened during the COVID-19 pandemic. So mothers and infants are purposely isolated from each other, especially in countries like China, Indonesia, Philippines, and Malaysia. So these infants couldn't drink enough breast milk from their mother. Therefore, this is responsible for the rising number of stunting. This phenomenon illustrates how important breast milk is to prevent stunting. So although stunting could negatively affect children's productivity and academic potential, it is very, very hard to treat stunting. Therefore, it is important for us to know how to prevent stunting.
Next, we're going to discuss about the prenatal and postnatal approaches to prevent stunting. The prenatal approach is critical in preventing stunting. Here are some ways to prevent stunting through a prenatal approach. The first one is promoting maternal nutrition. Adequate nutrition during pregnancy is essential to increase stamina and maintain weight so that expectant mothers can stay healthy and avoid pregnancy complications. The second is to take iron supplements to prevent the effect of anemia during pregnancy. Expectant mothers should also take prenatal vitamins to provide additional nutrition needed for fetal growth and development. In addition, expectant mothers should also maintain a healthy lifestyle, gain a healthy weight, and get nutrition education and counseling. The postnatal approach to prevent stunting is equally essential as prenatal approach. Here are some ways to prevent stunting through a postnatal approach. The first one is appropriate infant and young child feeding practices. Infants should get exclusive breastfeeding for the first 6 months and continue with the introduction of complementary foods until the age of 2 years. Stunting can also be prevented by immunization to help prevent illnesses that can lead to stunting. In addition, good hygiene practices and sanitation and regular monitoring of child growth and development are also essential to prevent stunting.
Next is stunting management. Based on the Ministry of Health, stunting management will be handled by pediatricians and involves three important aspects. First is nutrition management by giving enough nutritious food. In this case, animal source food will help to improve the amount and bioavailability of micronutrients, and the food should be given with the correct timing and enough energy, with protein energy ratio PER 10 until 15%. And the next aspect is regular sleep schedule, and the last one is regular physical exercise, minimum for 30 until 60 minutes, done at least 3 until 5 days a week.
Stunting prognosis. So the outcome of stunting depends on the age they acquired stunting. Studies shown that older age stunting have more chances of catch-up growth than earlier age stunting. Next, stunting or malnutrition changes the function of the brain, which leads to delayed cognitive developments, and this causes uh, poor performance in school usually. And they also have low productivity, leading to financial difficulties in the future. Lastly, they also have early onset of diabetes because they have insulin insensitivity and low insulin secretion from the body because of the fat losses.
Conclusion: stunting is a condition where a child's height for age is below the median by 2 standard deviations. Signs of stunting can be shown by lower in both height and weight, delayed bone growth, and younger appearance. Stunting can be caused by nutritional, psychosocial, and infection problems, but it can be prevented before and after birth, and it can also be treated by therapy.